guys. My name is Dr. Alan Au. I'm a registered pharmacist from New Jersey, and thank you for joining us on this month's International Society of Cannabis Pharmacists State Series. This month, we're featuring Illinois. And with us today, we have two special guests. One is Starlin Hayden Greeting, and I'm going to let her introduce herself and a little bit about her background. And we also have a pharmacy student, Jessica Burke, and she's going to do a lot of the fine details of the program. If you guys have any questions, feel free to put it in the chat. We can discuss after in the Q&A section. But if not, I'll let you guys take the lead.
Okay, I'm Starlin Hayden Greeting. I graduated from the school formerly known as St. Louis College of Pharmacy in 1981. So I'm a 5-year grad, and then I did a residency with the Indian Health Service and then came back and was interested in epidemiology. And so I got a master's in pharmacoeconomics and a master's in public health. So that makes me a pharmacoepidemiologist. I also did a fellowship in DC, and I worked with all the pharmacy associations and medical associations during OBRA 90, and came back to the state of Illinois, and I was 50% feds and 50% the state of Illinois. I was the director of quality assurance and utilization review for 26 years. And then they gave me shingles, and I decided to start my own consulting business. And so I still consult for Medicaid, the Department of Public Health, and the CDC. I just do projects. And so that it doesn't drive me crazy, because most politicians are scallywags. So that's my story, and I'm sticking to it. But I also currently am the director of clinical programs and population health for the Illinois Pharmacists Association. So we are actively involved in trying to promote the use of medical THC and CBD in the state of Illinois. So, and my wonderful assistant, who really got this going, I want to thank her for inviting me to be part of this with her. But Jessica is an outstanding student pharmacist, and she has quite a river of knowledge and experience in the Chicago area. So I'm going to let her talk about herself. Jessica?
Thank you so much, Starlin. That was an awesome introduction. So like Starlin said, my name is Jessica Benitez Burke. I am a student over at the UIC College of Pharmacy. Set graduation date is 2023, so 2 more years, yay. So I worked at Walgreens as a pharmacy intern for roughly about a year, and that was right at the start of the pandemic, which was lovely. Definitely showed me the before and after of how Walgreens really transitioned. And it was a really great experience I went through the entire thing of prior COVID to giving vaccinations right before I left. I was also working at Advocate Aurora Christ Medical Center as a pharmacy technician in the main pharmacy, which I worked with a great group of people there. I honestly appreciate everything that they taught me over there and how involved I got in understanding everything in the hospital pharmacy. Unfortunately, that one was like a short little run, but that's because I got hired on at UIC as a graduate research assistant over in the infectious diseases department. And we're currently working on a couple different experiments dealing with really bad gram-negative bacteria. And we're trying to find different combinations of medications to try and help clinically speaking, especially with these really bad gram-negative bacteria. And if you guys ever have any questions, my contact information is below. So if you guys do feel like reaching out to me afterwards, my email is right there for you.
All right. So we're based like all the other talks you've been having. We're going to go over the patient certification process, a snapshot of the program, our role as pharmacists, and some additional resources. So Jess is going to start off with patient certification process. And Jess, just tell me next, and I'll advance your slides for you.
Okay, perfect. All right, so Illinois has a really, what I really like about Illinois is that we have a really like two different unique programs. So we have the medical cannabis patient program and the opioid alternative patient program. And they kind of correlate, but I'll show you guys go through the differences between them two. So the medical cannabis patient program is the one that you typically think of a medical marijuana card. So this one is for very specific debilitating health conditions, and Starlin will go through the entire list with you and point out like the more important ones. But the program's official start date was September 2nd of 2014, but the pilot started in January 1st, 2014. So Illinois was also the 20th state to have a medical marijuana program too. So with the medical cannabis card, you could have it for anywhere from 1 to 3 years of active registration. And after which during that time, you're gonna have to renew it, but the renewal process is always much easier than the starting up process. So there is no minimum age to it. And I say that kind of with like a caveat, just for the fact that you need to have a parent, guardian, or the otherwise that needs to be in charge essentially of your medical card. You need a caregiver essentially was what I'm saying. So there is no actual minimum age, but you need to have a caregiver if you are under the age of 18. So, and then on the bottom, I have listed the different prices for each card. So $100 for the first year, $200 for the second year, and $250 for the 3-year. Then for the opioid alternative program, it's for opioid alternative use, especially in pain. So, and with that being said, it's like instead of being given an opioid for pain management, you're going to be given the medical marijuana for opioid alternative card in order to make sure that you don't only stay on opioids. It's a very nice little extra thing that I really do appreciate that the state of Illinois is doing, because essentially what they're trying to do is to prevent opioid addiction and the opioid and avert the opioid crisis. So I really, really am a huge fan of this program. But the program start date was January 31st, 2019. And as opposed to the medical cannabis patient program, it is only a 90-day active registration. And the main reason for that is because it's meant to be short-term. It's not meant to be a long-term program like with the medical cannabis program, which you have like a debilitating condition. This is very much short-term, especially like after surgery. If you get, obviously a lot of people get prescribed opioids. It's to replace opioids for a short period of time. So the minimum wage in this program though is 21 years. And it is only a $10 registration fee because of the 90-day activation. Yeah, and you can go to the next slide. All right, so I'm going to go through the registrations and rules with you. So the written certification for confirming diagnosis for MCPP, like I specified before, for the MCPP, sorry, the certificate that you need to get from the doctor or any other certifying healthcare professional is only valid for 90 days. So essentially what that means is you need to apply for the medical marijuana card within 90 days of getting the certificate. And the certificate is just confirming the diagnosis that your doctor gave you, just saying like, yeah, no, this patient does actually have what it is I'm saying that they have, and it's certified by the healthcare provider. But in contrast, for the opioid alternative program, the certificate is only valid again for 30 days because it is a short-term program. So certifying healthcare professionals would be doctor, the medical doctor, or the DO, I can never pronounce it. And then also the advanced practitioner nurse, and a physician's assistant can also be a certifying healthcare professional. With this card specifically, and I feel like it's almost common sense, but you have to be a resident of the state of Illinois. You also have to be living in the state of Illinois during that time. Like you must be a resident just because this is a state regulation. It's not a federal regulation. So when the healthcare professional gives you the certificate, there's a couple of things that they have to certify. So they're certifying that they have an established bona fide health relationship with the patient. And what that means is they need to be this person, the patient needs to be their patient. It's not a one-time meet. It is a long-term thing. And you know, the doctor is also actively taking care of this patient and overseeing the patient and the patient's outcomes. The doctor must also conduct a physical in-person exam within the last 90 days. And with that being said, that's what the certificate is. The certificate that they need to get is pretty much saying, but the doctor, it just needs to be within 90 days. And then also perform an assessment of the patient's medical history and medical records from the prior 12 months. And this is also just for the patient's safety, is essentially going to see the last 12 months, making sure, you know, is this right for the patient? Will it benefit the patient? And answering questions of the like, just to make sure that it is right and it's going to help out the patient. And also you need to explain the risk versus benefits with the patient. Just like with everything else, you need to let the patient know 100% what they're getting into and whether it'll benefit them or not. So then they're also making a conscious decision on it. Right. And then with the registration and rules continued, there are a couple limitations to it. So one of which is in the laws, it does say that the patient can get an adequate supply. So what an adequate supply is, which a lot of times patients will ask, is 2.5 ounces per 14-day period. Just in case that is not enough for the patient, you can always apply for a waiver, increasing their supply to 2.6 to 36 ounces. So that's always a possibility if the patient is worried about that. You can only purchase in a licensed medical cannabis dispensary, of which there is about 55 different 55 to date dispensaries. So that shouldn't necessarily be a problem, but that's something that the patient really needs to be aware of, because we know there's always different ways to try and get it. So CDL or school bus drivers cannot apply. And the reason for this is because it's more about safety than anything. And also on top of that, a lot of CDL drivers are driving over the road, which is also, it becomes more of a federal regulation. So that's the reason why those two cannot apply for it. Also, an active duty law enforcement officer, correctional officer, correctional probation officer, or firefighters are not able to. And again, it's probably for the same reason as the CDL. It's more of, they definitely can. And it deals with their work more than anything, which is, and it may be a little bit upsetting, but hopefully if we find a way, maybe that will be changed in the future. But as of right now, as long as it is state regulation, I don't think that's going to happen. Also, the state of Illinois does not allow medical marijuana reciprocity. So with that, what that's saying is we do not recognize other states and their medical marijuana card. We only recognize ours. The good thing, and I guess the caveat, so to say, is that because we have it recreationally legal, that they can obtain it recreationally, but it won't be, I know with the medical marijuana, if you get it and if you have the card and you go to a dispensary and get it, you get a tax break. So I mean, that may be the issue, but I mean, at least there's a caveat to it. So you also can only select one dispensary as your primary dispensary. So if a patient has a medical marijuana card, they can only go to one place. The good thing is, because registering your dispensary, you do it online now, as opposed to before where it used to be a whole paper project and it would take quite some time. But luckily, this is a 1 hour thing. So if, for whatever reason, a patient is going somewhere else or visiting their family that's in a different part of the state of Illinois, they can always change it. And within an hour, they can go ahead and actually go to that dispensary because that would be their primary, new primary dispensary. All right, you can go to the next one. All right, so the registration process. First, you have to obtain the physician certificate, like I previously mentioned, from the prescriber. Veterans have a little bit of a different process, and veterans receiving care from the VA have to provide 12 months of the VA medical records instead of a physician's certificate, which it makes it a little bit easier, I would say. But the reason why is because if they're going to the VA, they naturally assume that they're being taken care of by and having a bona fide relationship with their physician. For the MC, for the medical card program, patients must apply for the card within 90 days, as previously, like I said, from the certificate completion, and as opposed to the opioid alternative, it must be done within 30 days. Patients also have to gather the following documents, which is a government issued ID. They have to obtain a passport photo. And if they do qualify for reduced fees, they need to have a copy of their Social Security benefits, a verification statement. And veterans will need a separate document, which is their DD-214, because they can also apply for reduced fees. Then, obviously you need to get the application fee, which I will talk about later. And then identify caregiver if need be. And patients can have up to 3 caregivers, just in case, they were curious about that. And the minors, which I will go into that later, they don't need to pay a caregiver fee. And that's because they're required to have a caregiver. And then you can always, oh, Starling, could you go back one slide?
Sorry.
No, it's okay.
Finger.
So on the bottom, I put the link for to complete the application, because it is an only online process, which makes it so much easier. But you can go ahead to the next one.
It's smartphone friendly. So
yeah. All right, so now we're going to talk about the minor applicants. So they can, just like the adults, apply for the 1, 2, or 3 year card. They must also have a debilitating condition. And 1 caregiver is included, like I previously said. You can have a second caregiver, but they need to have a $75 fee. But it doesn't break down like how the adults have their caregiver, because you just pay for that one-time fee just to add on that additional caregiver. And let's see, application fees are the same as adult application fees, other than obviously the caregiver fee. Healthcare, so this is really important, is the health. So minors need a healthcare professional certificate, and they need a reviewing healthcare professional certificate. So as opposed to adults who just need the healthcare professional certificate, minors need 2 reviewing doctors. And this is mainly just for their safety, to make sure that it's kind of a double check, just to make sure that, hey, is this right for the minor? And I feel like it's mainly more for safety. But with that being said, they don't need a photo ID for the cards. And then also you can have 2 designated caregivers. Like I said, the second one is you're gonna have to pay a fee, but it is biological parents or legal guardians. All right, Starlin, you can go to the next one. All right, so and then this one just goes over the reduced fees, who qualifies for it. Veterans, if you have a disability, are enrolled in Social Security disability income or supplementary security income. And if you have disabilities and you have been employed by the following, so like the U.S. Railroad Retirement, Teachers Retirement System, and the Illinois State University's retirement system.
So I have a question, Jessica.
Yes.
Having been a past Medicaid director, if you have Medicaid recipients needing this, how are their application fees paid? Was that covered in the rules and regulations?
They have to still, it's not going to be covered by insurance. So because Medicaid's an insurance, they said that everything they still have to pay for out of pocket. So it's not, it will not be covered.
That's interesting.
Yeah, it was something that I saw briefly, but it won't be covered by them, which I mean, kind of is what it is, but I'm not sure why they won't. Now, as far as that getting changed in the future, it may or may not happen, but I guess there has to be a push for it. But they will not cover this. The same thing like marijuana won't be covered in the dispensary, even though it's like deemed a prescription, if that makes sense.
One of the issues that I need to bring up to everybody that's just not Illinois, but Medicaid is anywhere between 50 to 90% covered by the feds, depending on how you have registered your Medicaid program for your state. And so if whatever portion is coming from the feds for supplementing the Medicaid program, federally, this is illegal. So the feds will not let us use money for this. However, I serve on the Medicaid opioid task force, and we are trying to show that we could reduce the opioid use if they would waiver and allow us to put them in the opioid program. So just a caveat there. Okay.
And honestly, I wish that they would do that for especially the opioid program. Like I said, I'm a huge fan of the opioid alternative program just because like you said, there's plenty of people who are like, using opioids for pain management, and it's really detrimental to their health. And so like, yeah, hopefully that'll be changed, hopefully in the future. But like you said, because it's federally illegal, it's going to be an uphill battle, if not already has been. So we're going to move on to the application fees. So remember, like the opioid alternative program has that consistent $10 application fee, and that's mainly because it is a short-term program. But as far as the applicants, like I previously mentioned, $100 for 1 year, $200 for 2 year, and $250 for a 3 year. So obviously for the 3 year one, it's going to be slightly cheaper. So I mean, if your patients can, I would definitely just urge them to go with that one. If they don't qualify for the reduced application fees. So also a caregiver is going to have to apply separately with a $75 caregiver fee. And then, also something to note is even if the caregiver and the patient don't apply at the same time, the caregiver and the patient will have the same expiration date. So if you wanted to get a caregiver put on at a later date, regardless, it's going to be the same expiration date for the caregiver and the patient who holds the medical marijuana card.
All right. So there's over 52 qualifying conditions, and it's very expansive. And so I'm not going to read every one of these to you. All the way down to ulcerative colitis, that's 52 conditions. What's more interesting is to look at this chart that the department has placed in the registry program, and you can see the number one use is for chronic pain, and then post-traumatic stress disorder, and osteoarthritis, and migraines, and cancer. So these groups are the most, and of course seizure for epilepsy, but I would have thought there would be more, but a caveat to our kids that have the terrible seizures that require the THC as treatment, most of them become dual eligible Medicaid recipients because the parents need so much help because of their their health situation, and they're in and out of different health, either the hospital or acute care. And so because Medicaid is dictated by the feds, we can't get those kids covered for seizure, but we do cover the prescription THC version on Medicaid for those patients. But in Colorado, you would see this number bigger. Colorado has a Medicaid, children's Medicaid program that is somewhat different. They don't use any, they use their marijuana, their recreational marijuana fees to pay for indigent children with epilepsy, so that the feds aren't paying for it. The state themselves are paying for that use. So that's, and they do that for any child that has any of these disorders that the feds won't allow Medicaid to pay for. And so the least is the terminal illness of cachexia wasting syndrome. But again, what you need to realize, the reason why the numbers aren't up on this would represent commercial insurance within Illinois. And if you're getting a dual eligible recipient, that you get some sort of federal funding, you're not allowed to use it on this. So that's why there'll be like a private arm or people pay cash for that process. Here's a review of since June of 2020. I think that these numbers are going to change. COVID really interfered with our ability to collect some of this data to keep it up to date. So this is all that Jessica could find was the last report. So again, these numbers are really small because, in a state the size of Illinois, I mean, if you just look at Chicago itself, that we've got to have more patients than that. It's because of the way their reimbursement for their insurance is. So if the one of the hopes that we had was that, when the Democrats took over the House and the Senate, and we have a Democratic president, the thought process, as everybody thought, is that their people would be a little more forgiving, and maybe we could get the THC put into a C2 across the nation, so we could A, study it, and B, have some more ability to give these products to patients that need it, especially in the opioid world. But COVID has just overshadowed everything. And you probably know we've had a rise in opioid deaths. So this came up on topic, but President Biden is known to be hard on drug use, and also the Vice President Harris, when she was she put a lot of people in jail for drug use in California. So they're kind of have a background of being hard on drugs, but I think that's changing, thank goodness, because now it's a disorder. It's not the evil process that everybody thinks it is. And so it's part of that mental health and health behavior disorder area, so that maybe we can start treating this as part of our medical responsibilities. So maybe that'll change. But right now, FDA doesn't, and the DEA has a pretty big strong hold on it. So certifying providers for either one of these, unfortunately, pharmacists weren't included in this. We really did. I mean, Melanie actually sent me the Minnesota's legislation, and we actually took excerpts and placed them in that task force, so that we wanted to do exactly what Minnesota was doing, that they had to have a pharmacist in a call center or directly related to the dispensary to cover those medical information, and that got pulled out. Illinois is very so the national headquarters for the AMA is in Chicago, and the Illinois State Medical Society has a lot of political clout, and and therefore we have to move slowly and behind the scenes, and we can't draw attention to what we're doing. Right now, we have our House Bill 135 is on the governor's desk, which expands the ability for pharmacists to dispense oral birth control, and we're we have if once it's signed, because we use general language, it does open our scope of practice up so that we can refer to it to do other things. And so we're trying to address it that way so that pharmacists could be more involved. I actually polled my husband was a pharmacist but became a doctor, and I polled his group, and they know nothing about this. They want Jessica and I to give the same talk to the Springfield Clinic doctors so that they can understand that why patients may be coming to them and wanting them to be certified providers. They have a pain and palliative care physician, but he's overwhelmed with it. So we need more. We need more of those certified patients. And then providers, I mean, the Illinois Department of Public Health does not provide a comprehensive list for anybody. You can't go in and like you can if you wanted a diabetes educator, you can go online and ask for a diabetes educator, and then the map shows up. They're not doing this for certifying providers because the medical providers wanted, this is the line they wanted the conversation between the patient and the healthcare provider that was treating the debilitating condition. They want that patient. The other reason why they don't want that, they don't want doctor shoppers. And when Jessica was going over all the processes that the certified providers have to do with the patients, that's also placed in there because we have a lot of and this is because I used to work for the government and I saw all this, but we have a lot of fake doctor offices that people go in and get the fake scripts, and then so they really spend a lot of time ironing out all that certification process so that people just couldn't walk in and get what they wanted and then walk out. The other thing that took the pressure off that as well is that we passed the recreational marijuana process. So that kind of took the wind out of some of those people that were trying to get certifications. The requirements, they have to be a licensed practitioner in Illinois in good standing. This is all in Illinois. And must hold a controlled substance license, and must keep records of the debilitating condition. And these records, all of this information is can be audited, and it will be audited by the Department of Financial Professional Regulation. So you can also check on those records, but it's part of the routine health professional auditing that goes along in the state of Illinois. So the available products in the THC world are obviously the flower, the bud, and some, in the pre-rolled joints. I mean, we could start going in and talking about all but you have to understand my background and why I'm interested in that, because I have people saying, why are you so interested in this area? Well, my brother had a rock band, and he traveled with the Eagles back in the 70s, and when he came back from that, he ran the sound and the process of the Mississippi River Festival. So anybody that's older, my age or older, we used to have SIU Edwardsville had this huge campus, and they used to have like mini Woodstock concerts there, and I would go out and want to go see you know, the bands that were playing, and I witnessed everybody. I mean, LSD was big in 72, 70. Well, it's still big, but it was really big in the 70s. And I was like this little nerd pre-pharmacy person taking notes, watching people experiment with medications. And I couldn't understand why people would not take their medications they got from the pharmacy, but would take medication from some dude selling something behind a tree. So anyway, so I've always been interested in the benefits, and I've always been concerned about the interactions of some of the chemicals that we use. And it's a shame that we lost 60 years of research because we had a bunch of great white wall of men controlling the system. But anyway, so in Illinois, we have the flower, the bud, the cartridges, the concentrates, which can only be these percentages, and then edibles in THC that are dispensed by the dispensary, the teas and sodas, tinctures, tonics, and oils, and then topical forms, and all these other that go directly on the skin. I'm waiting for them to get a patch. I'm a group I work with right now is experimenting with the patch because I think the patch would be very good for pain and palliative care. All right, so now we're gonna do the program snapshot, and I'm gonna turn it over to Jessica.
So also, Starlin, I actually have one little thing to add actually to the products. So I know that we were talking about minors, and the weird thing is, like, so obviously in the state of Illinois, you are not allowed to buy, well, if you're under the age of 21, you are not allowed to buy anything that's smokable. So if you are, there's that awkward in between range of being a minor between 18 to 21, where you're not allowed to buy like marijuana that is smokable, but you are able to buy anything that is like a baked and edible, if that makes sense. So there's that, I forgot to mention that earlier under the minor section, but there is that little weird in between, awkward in between for them that you can only buy like baked goods and edibles as opposed to smokable products where if you're over 21 years old, you can.
Yep. And they reinforced that in this last legislative session because of the vaping.
Yeah.
We have a whole new set of vaping rules that came down, which impacts this whole area right here as well. Good point. Excellent. All right.
Great. So I'm going to go through the program snapshots. So at the time when I made it, it was May. So I left all the May stuff on here, but I will mention a couple more updates in between that's happened between June and July. So as of May 5th, 2021, there were over 150,000 approved applicants in the medical marijuana program. And 108 of these were under the age of 18. As of right now, 823 patients are under the age of 18. Also, patients as of this month of July, it's over 158,000. So the reason why I'm mentioning that is because it's slowly trending upward. And even back when marijuana got recreationally legal, it kind of plateaued, but it's still, after a little bit, it went back to adding on about 5,000 people a year. So it's slowly trending upward. Well, now it's trending upward again before it kind of plateaued for a little bit. But overall, this entire program is adding a lot more people on as the years are going. There are over 5,300 providers. Now, as we talked about before, you need to, like there isn't a comprehensive list of, hey, let's find a provider, but you can always have a discussion with the provider to become certified, especially like if this is something like you hear a patient really wants, they can always have that discussion. So then the provider can get certified. So then the patient is having a bona fide relationship with that provider and can get what they're seeking. There are also, as of June 30th, there are 21 growers and manufacturers. And then, like I mentioned before, there are 55 licensed dispensaries, and that number stayed pretty consistent throughout the years, especially since when they first, I think it was back in 2014, they opened up for applications to open up as a dispensary. So it's been pretty consistent around 55.
Well, no, it's expensive.
Yeah.
Your,
Yeah,
your initial registration points are $250,000 without, you don't get it, if you're not approved, you don't get the $250,000 back.
Yep, and it's like pretty much a lottery too. It's yeah, and actually in one of the resources, we were provided with a resource that gave us, it explained like the lottery type of process, but it's very interesting when you read through it, because it's like Starlin said, you don't get that money back. So it's kind of rough, but you can go on to the next one. All right, and then for the opioid alternative program, there have been 883 patients. Now, this number may seem a little bit small, but you gotta remember that this is a short-term program. And a lot of the times, once the patient is done with the opioid alternative program, they can get switched to the medical marijuana program, especially if they have the debilitating condition, where you can see if, let's say, the patient has pain for a short period of time, but then it gets classified as chronic pain, they can always switch over to the other one, which is also probably a reason why the number is growing significantly more. There are 1,600 patients waiting physician certification. But as of right now, that number has dropped to 125 patients. And yeah, which is insane when I found that out. So it's no longer that 1,600, it dropped down to 125, which is fabulous. I'm assuming that they figured something out and got it going, but yeah, so it dropped significantly. Even from the last month, it was still in the 1,600s.
Well, the physicians were allowed to do telehealth histories and physicals, so they had to wait for COVID to die down and for people to come back so they could have in-house physicals. So that's, and they're probably caught up now.
Okay, that makes so much more sense. So there are 734 physicians that are registered with this program. And it may seem like a small number compared to the medical marijuana program, but remember, this is a newer program. So that would explain why it's like that. But like I mentioned before, patients can switch from the MCPP afterwards. Oh, also patients can't be in both programs. So once you're in one, you have to go from one to, you can only pick one, which is where is that switch. All right, you can go on to the next one.
Okay, so we're going to kind of go real quick over the roles of the pharmacist. As we've already mentioned, we aren't legally mandated to do anything, and there are a few pharmacists that are working in the medical marijuana only dispensaries that have that interest, and those dispensaries are what I call the smart and the forward thinking dispensaries. We'd like to see that pattern go carry out more, and it's starting to catch on. But we in the Illinois Pharmacists Association believe that pharmacists, so back in 1843, pharmacists were in charge of all the chemicals that were housed, even alcohol during the Prohibition. So we think it's only a matter of time that we'll increase the utilization in this setting. So what we're doing in Illinois is we have created, and I included the 2 acts in there because it's an agricultural act for industrial hemp, but we're trying to create a standard CBDs, because I'm part of 25 pharmacists went together and we created Virax, which is a laboratory that is testing CBD products after they say they put CBD in some sort of product. There are many products being sold in gasoline stations and video stores, if there are any left, but not in, and some pharmacies are carrying products that just have menthol and salicylic acid in it, and they say they have CBD, but the shelf life it's so small and the shelf life is so bad that when we go and grab a bottle and test it, there's sometimes nothing at all in there, but they're paying this high cost. So Virax is trying to create a pharmacy owned pharmacy seal of approval by pharmacists so that we can help guide our patients into the appropriate type of CBD and hopefully maybe in the future THC. Right now, the THC world is kind of being controlled by the feds and closely watched at, but because there isn't CBD supplement testing by the USP or by the FDA, we're trying to show that some of the products that are out there shouldn't be out there. And so and also within Illinois pharmacists, we're trying to do a farm to pharmacy CBD product to where we know where the CBD is being organically grown and it's being produced into the topical products for us to carry within the pharmacies and for primary care physicians or pain management physicians for them to carry in their offices. So that's our big project that's going to launch in August. So we encourage all the pharmacists to be involved in the medication therapy management and comprehensive medication management, because whether at some point or another, your patients are going to be using these, and it's very important that we pay attention to these drug-drug interactions. One of my biggest fears is having an osteoarthritis patient who uses a non-steroidal for their osteoarthritis, and then they start using a THC product or a CBD product, and then that's blocked, so they eat more non-steroidals, which causes them to have heart problems. And I'm preaching to the choir here that we want to be the kings and queens of medication management and to help our patients do the best that they can. A lot of patients don't understand the delivery of these products. The same with prescriptions. We've entered an era where there's all these alternative ways of consuming medications, and sometimes unless they're experienced in some of the delivery mechanisms, we need to teach them how to use that. And the self titration, it's interesting. If people with diabetes have problems titrating how much insulin they should use, imagine how to be able to decide how much you need for pain. And that 0 to 10 only works so much. My 10 may be different than your 10. And so just being able to have a shared decision making about how to appropriately use these medications is very helpful, and it creates that patient support. I mean, pharmacists are one of the most trusted professions, as you know, and we see patients 15 times more than any other profession. And so it really is part of our oath of office to provide this support to our patients. And our additional resources, these are all the links that Jessica and I used, and I've doubled them up because it's important for people in Illinois to understand where the actual laws are in the directories. They're hard to read. And then I also added the CBD information in there. And then these are more. well, you want me to stop there or you want me to just get done with my slides so I can see people? I'm gonna end it. There. Okay. And I can stop sharing. There we go. All right. We got 3 questions in chat.
Yeah, wow, that was a lot of information. Thank you guys so much. I love presenters that go through a very thorough, presentation, because there's so many questions and every state is different and unique. So I'll go through the comments real quick. So Ann Berg said they do have patches. I'm assuming transdermal patches. Okay. Question regarding inhaled products and minors. Do your dispensaries carry inhalers similar to MDIs? I'm going to assume the answer is no, and minors can't use inhaled products, but I'll let you answer that.
Jessica, do you want to address that?
So no, and I'm not sure whether it's because there isn't a. I know that there's products in development for a THC inhaled, but as far as our dispensaries go, I want to say no. Every place that I looked at just to see what dispensaries do carry, there was no mention of an inhaler. They always mentioned the oils that you would put like in a vape pen, but there was nothing that said inhalers. So as of right now, no. And I'm not sure as to why, but I know that they are developing inhalers, but it's not around Illinois. As far as I'm concerned, I'm pretty sure it's in the southern states that they're coming up with one.
North Carolina. We have been working with some pediatric people that have been using nebulizer because of, creating the liquid and then putting it in a nebulizer for the vaping. But again, we don't have enough evidence research on it. And it's in a pediatric population. So that scares a lot of the medical directors for that use. And the other problem is most of the respiratory treatment centers have federal. They're a little gun shy at entering into that because of the federal match money that comes in through to them. So that's why if we can get more them to at least move this to a C2 federally, then we could have better evidence in working in those environments.
Sure. Yeah, and I know of a company called Dosist. They had produced a device that it's exactly supposed to do that, give a metered dose, not exactly like a spray inhaler or a albuterol inhaler, but similar concept.
Right.
Yeah, and the lipophilicity of cannabinoids is a big problem when it comes to nebulizer solution, because most of the albuterols are aqueous, and how do you test that in a laboratory? Who's going to fund that? And that's the problem that revolves with anything with cannabis research.
And how do you consistently measure that? Because of the yes. So I think it's going to get there. I think it would be. I think it would help, especially with the children that are having some of that. I mean, it's the fastest kinetic. It has the fastest kinetics when you inhale it. So if you had somebody that was having, instead of giving them an injection of Valium or a benzo for an epileptic seizure, they could abort that with that metered dose. But again, the federal matching money, and then I mean, we're having a hard time pulling pediatric population to test the COVID vaccine. So
Right. So Anne had a question. Are you publishing the results for your CBD testing, or is it just kind of like a spot check third party?
No. We are going to, we're right now we're in the middle of cranking out lots of publication, and we had a hard time getting funding because you can't have a federal bank give you money to fund, and we were trying to strictly do this as CBD, but they still relate that to THC. So there's those FCC rules, but yes, we will be publishing all of that, and and I'm not completely in charge. I'm just in charge of the Illinois link, and August is when we release our information to the folks to see if we can get that to be um, across state. That's the other problem. Colorado can do Colorado, Illinois can do Illinois, New Jersey can do New Jersey, Ohio, and these are some of the states that are all involved. There's 25 of us,
Yeah.
and so what we're trying to do is we want it to be consistent across all states, so that it is like a USP for for that product, and because we may wait years before the feds do anything about it.
Yeah, unfortunately.
I
So we are running a little bit short on time. I just wanted to throw in a couple questions. Was there, did I miss it? Are there any products that are specific for medical dispensaries still versus adult use? Or are they all kind of the same?
The products are the same.
Okay.
The main difference that I would say about anything is mainly about the supply. So a lot of the times they will hold a specific supply just for medical use. And that is mainly because, you know, if you have a medical card, they want to ensure that you get your, like, you know, the marijuana that you need because you have a medical card. You're not using it recreationally. So that's the supply amount is the main difference.
Yeah, so certain states have potency caps and specific, types of categories that are available to medical patients. Just want to double check. So what other benefits would a medical patient have of staying a medical patient besides the tax benefits?
Well, I mean, like that was the one that the other mention too is you get first priority over
Okay.
other patients, especially recreationally.
And so-
Um, yeah, I feel like that's the biggest thing. Also, not only that, like, and I guess this isn't like a legally benefit, but one of the biggest benefits I see is also having the ability to talk to your healthcare provider and talk to them about, and like Anne said, yeah, you can grow up to 5 plants recreationally, you can't. So
Right.
but even then being able to talk to your healthcare provider and having that open relationship. Also, there are dispensaries that do provide kind of like a consulting thing where they'll talk to you about this stuff. Granted, the people in the dispensaries that I know of are not medical professionals, which is kind of weary. So hopefully that'll change. But it's more about having an open relationship, talking to your healthcare provider and be like, hey, I feel like taking this medication, or you saw that I was taking this medication. You also know that I'm using medical marijuana. Let's talk about the benefits. Let's see what I should and shouldn't do. So I feel like that's the biggest benefit other than the tax breaks, but yeah.
Yeah, and that's one of the biggest resounding issues that we see with medical programs that eventually turn adult use. Everyone says that the medical program gets destroyed, but at the same time, I think there's a truly unique opportunity for pharmacists to get more involved, because having an adult use market will open access to patients, but it's just about that kind of professional guidance that we can provide through our advanced patient counseling measures, through our understanding of pharmacokinetics and everything else in between. So I'd love to see pharmacists that are still involved in Illinois. That's kind of reassuring, since, for example, New Jersey is on the cusp of going to adult use. The regulations haven't been written yet, but at the same time, I, as a pharmacist, want to get involved more with medical patients after the fact, because more people have access and some of them won't really know where the guidance lies.
Well, I have patients, because I have a big diabetes practice, and they tell me for their peripheral neuropathy they're using now that we're adult, and so I've got them titrating so that they you know it, and I do it as part of the diabetes education time.
Yeah.
But I mean, they're my patient, that's what they're doing, it's part of what they're living. And I think I think, I mean, we fought hard in the House of Delegates to get to turn the faces of the Great White Wall of Men at APHA and at ASHP. So I'm pretty proud of, I mean, if you think about, if we brought this up 15 years ago, and we were told to shut up, not to talk about it anymore. And now we're more open, and hopefully we can make this more of a professional privilege with students like Jessica that want to go out and have that, and yourself, Alan, and Melanie rocks. But Anne, I'm really excited that you're on here. I also have to let you know that I'm on contract with CDC, so right now I'm doing a lot of COVID, but I keep trying to remind them that there's, just because they're if they want to address this opioid addiction process, and we lost so many people during COVID, we need to be able to expand these services and keep this in the pharmacist scope to practice. So
Yeah.
We're still serving on all those task force, and I called Garth before we got on here, and I said, so I wanted to check to see if there was any legislation looming in the veto session about some of this stuff. And he said, if they walk away from the CBD act, we're gonna push it, and that, because what we'd like to do is require CBD to be only sold in pharmacies and not in gas stations.
Yeah, it's a great point.
Yeah.
Okay, so it looks like we're out of time. Any final closing remarks that you want to share? Again, thank you so much for your time. This is the first time we're speaking, really thoroughly, but I'm so glad that I met the two of you. Jessica, you have a very bright future, just telling you now.
Yeah.
God, I hope so.
I was very excited to meet her, and she literally just put this call out. Is there any pharmacist who would do a THC talk with me? And her mentor at the U of I was a student of mine, and so she sent it to me, and I said, well, I'm a member. As soon as Melanie came and gave her presentation, I signed right in. So I'm excited about our future, and I'm excited about us helping patients in that non-traditional process. And this is on my boat to fight for. So yeah, so I'm happy to work with you guys, and the Illinois pharmacists are happy to work with you. And so I've encouraged a lot more people to join the national group. So we're starting the troops. We're building the baseball field, as they say. If you build it, they will come.
Right.
So.
And Jessica, any last remarks?
No, I just, well, I mean, other than I want to thank Starlin for really helping out on this, especially her guiding points on this have made this a lot easier. And Alan, I'd really like to thank you also for guiding the discussion in this. And this was actually a good learning experience, and I really enjoyed it.
Yeah. All right. Well, again, thank you so much. So the ISCPH does a monthly series, State of Cannabis series. I think we are taking August off. However, in September, we're going to reconvene, and Texas is next on the agenda. So as soon as we find a date and a special guest, the information will be on our website. So keep a lookout for that. All right. Have a great rest of your Monday, guys.
Thank you, everybody.